Hello, everyone. Thank you for joining us today. My name is Wintana Bairu, and I will be the moderator today. Joining us are 3 expert health professionals, Dr. Goitom, OBGYN and clinical instructor at Johns Hopkins School of Medicine, Dr. Solomon Iyasu, Merck & Co. VP and former ex-FDA director, and Dr. Berhe, psychiatrist and assistant clinical professor at University of Alberta, Canada. In addition, we have on the call our standing panelists, Dr. Hanna, infectious disease specialist, and Dr. Menges Bairu. So without further ado, we would like to start with Dr. Adiam, who will be giving us a brief status update on COVID-19. Dr. Adiam. Thank you, Dr. Adiam, for being here today. I was wondering if we could go ahead and start with a brief status update as to where we are right now with COVID-19.
Okay. Hello, Winta. Thank you for having me, and thank you for everyone that took their time to come to this teleconference to participate in this discussion about the COVID-19. So, as you all know, this is a new virus, a new coronavirus that started in China that has pretty much affected the whole world now at different rates. And I live in Maryland, so in the United States. For those of you who are joining from out of the country, in the United States right now, the most affected state is New York with over 100,000. So today the governor was saying that they expect to see the peak in the next week or 2 weeks. So, and in my state, Maryland, we're expecting to see the peak in probably around the end of April, beginning of May. So every state, every country is in their own different trajectory because this virus has affected every country at different times. And the mitigations that they have taken, meaning the social isolations, the wearing the masks, and all the different things that each country, each state is doing, is not universal. So we are all going to see different peaks, different trajectories in different places.
So it appears that more is still to come. We haven't reached the peak yet. As the example that you gave, New York is still on the rise, and we'll see how things proceed in the next 2 weeks. As for the rest of us that haven't reached that level of cases that New York has experienced, we may be seeing this in the upcoming months.
Right, and everybody's peak may be different. We're hoping in Maryland that the peak won't be as high as in New York. New York is a very busy center, hub, financial center. They have trains and things like that. So people were infected at a much higher rate, and hopefully Maryland and other states won't see the extent of the peak that New York is seeing. And so all the different steps that have been taken, social distancing, people working from home, all that is going to result in significant decrease in the peak is the goal. So whatever we're seeing now is what we did from 2 weeks ago, because there's a lag in infection, and then usually people become symptomatic slowly in about a week or so after exposure, 2 days to about a week or so, and then the peak of the symptoms is usually a few days later. So people tend to really have significant symptoms probably about 10 days or so, and then usually we see deaths probably about 14 days later or so.
So from a prevention standpoint, what can we as individuals do to reduce our chances of being infected by COVID-19?
Yeah, so really prevention is the key since we don't really have vaccines yet or any definite true treatment antivirals. And I believe Dr. Solomon will talk about that, all the different things that are in the pipeline. However, so prevention for now is really the key, especially for the elderly and those with pre-existing diseases and for pregnant women. This includes frequent hand washing. So for about 20 seconds, wash hands thoroughly or use alcohol-based sanitizer. Also sanitize surfaces around the house, especially if people in the family are still working, so they're coming in and out of the house. Sanitize areas at work, such as the keyboard, tables, back of chairs, doorknobs. Avoid touching your face. Avoid touching frequent touch surfaces when out in public as much as possible. And, of course, avoid people who are sick. We've all been told to stay home, to practice social distancing by avoiding gatherings of more than 10 people and keeping at least 6 feet of space between each other. So that's very important, which is about 2 meters for those that are in another country. And then, even make sure you stay home as much as possible. And this includes not going to the stores too frequently. So when you go to the grocery store, make sure you buy enough groceries to last you for at least 2 weeks, if not more. Also making sure to have necessary medications filled in advance. So maybe having 2 months in advance if your insurance allows you, even 3 months, depending on your insurance. So these are important steps to take to decrease our risk of getting infected and also transmitting it to our loved ones. And then one more thing is it's really important to keep up with the CDC. So, there's a potential for misinformation to be spread through social media. So making sure that we are going to trusted sources like the CDC or the WHO websites to see what is new, what's happening, what they recommend, and not just following information that somebody posted on Facebook. Because there's plenty of misinformation out there.
And going along those lines, continuing on this idea of following recommendations by CDC and WHO, there has been a change of recommendations saying that masks are necessary. Could you please speak on that?
So masks, not surgical masks, not masks that, healthcare professionals use because there's not enough of those. So please don't wear those or buy those since they're widely in short supply. However, homemade masks are recommended. So the CDC recently came out saying that wearing masks outside may help in decreasing asymptomatic shedding, meaning people who do not know that they're infected, which a good percentage of people with COVID-19 may not know that they even have the disease. So they may go out and infect others. And this number, I think, in some places we're saying up to 30% of those infected may not know that they have the infection. So it's important to wear masks to decrease the transmission to others. It's not to protect yourself. It is really more to protect other people. And this is really not for people who know they're sick. They should be staying home and separating themselves from others until they're well. It's for people who think they are fine, who do not even know they're ill. It's for those so that they do not infect others. And another thing I would like to say is it's important to still follow the recommendations for prevention. So you still, even with wearing masks, we still need to be careful to make sure that we are 6 feet apart from others and that we try as much as possible to stay home, that we are constantly washing our hands and sanitizing surfaces. So all that still needs to be done.
So in addition to masks, is there anything else that is needed to help protect ourselves? We see images of others taking much more precaution. Is it necessary? Are masks enough to not only to decrease asymptomatic transmission?
Yeah, I mean, there is no 100% way to completely make sure that we do not infect ourselves. But these will significantly decrease our risks if we do these things.
And so moving forward, what are the symptoms that people should be looking for to be able to identify if they themselves or have been tested? What are the symptoms that people should be on the lookout for as red flags that they may have been infected by COVID-19 or their family members have been infected by such?
So the most common symptoms of COVID-19 are fever, cough, usually tends to be dry cough, body ache, feeling tired, congestion, runny nose. So just a variety. It's symptoms of a cold, but fever, sore throat, and cough are the big ones, as well as some people have headaches and diarrhea. And they've also been, recently they've been talking about decrease in being able to smell things, and that could also be a sign of COVID-19.
You know, some people have been saying, well, COVID-19, there are milder cases and there are more urgent cases. At what point should you go to the hospital or seek urgent care?
So about 80% of people who get the disease recover without needing any medical attention, not needing to be hospitalized. But about 15 to 20% can get pretty sick and will need medical attention. And usually it could be from pneumonia, which is an infection of the lung, and they can have difficulty breathing. These tend to be older people, especially people over 60, 65, and those with underlying medical problems like high blood pressure, diabetes, people with heart disease, or people taking medications that decrease or suppress the immune system, which is their ability to fight infection. And these could be patients with cancer who are on chemo, or patients with HIV and so forth. But if people have severe symptoms such as trouble breathing, chest pain, tightness, or feeling confused, or the difficulty arousing, their loved ones or something, then definitely they do need to go to the emergency room. Not urgent care, but I would say if you are that sick, then you should go to the emergency room. And usually you should call your doctor if you have a doctor, and also definitely wear a mask before you go.
Well, thank you, Dr. Adiam, for capturing the critical need to protect ourselves as well as others. As you've mentioned, the trying to decrease asymptomatic transmission, the critical use of masks, ideally not using that the health professionals need, as we're seeing a lot of shortages across the country, and highlighting a lot of the symptoms, many which have been newly found. So thank you. At this time, I'd like to reach out to Dr. Solomon to give us some insight on COVID-19 treatment and what is in the works. Dr. Solomon?
Yes, thank you very much. I'm very happy to be part of this panel and to talk a little bit about treatment and vaccines that are in the pipeline.
Appreciate you being here.
Yeah, thank you. So a little bit of description of how the virus attacks humans. Once a virus comes in contact with our airways, it finds a way to get into the cells, inside the cells, in the upper airway, and basically takes over the function of the cell and goes inside and replicates itself, which means it makes copies of itself. And these copies of itself, which are viral particles, then they exit the cell because they destroy the cell. And then those viral particles, hundreds and thousands of them, go on and infect other cells as well. And then as the cells actually are dying, a lot of these cells and the viral particles travel down to the lower respiratory tract into the lungs, and they clog up our breathing mechanisms. That's how we end up getting pneumonia. Sometimes there's also an overreaction of the body, and the fluids actually fill up the lungs, and oxygen cannot be exchanged between the lungs and the bloodstream. So those cases who are very severe are the ones who are having the most critical need for hospitals. So I think it was very clearly described earlier that there are clear patterns of the disease that are emerging. Most cases, most people who are infected actually don't show any symptoms, or if they show symptoms, they show mild symptoms. I think it was described as 80% to 85% of them, without actually needing hospitalization or critical care. 15% of patients may end up in the hospital, and another 5% may need ICU care, which is intensive care unit and ventilation support. And of all this, those who get infected, who get into the hospital and get ICU care, maybe 1% to 2% of them actually would die. So that's the pattern that's emerging. At least is being repeated in many different places. So in terms of therapies, one way of attacking the virus is to either prevent its entry into the cells or to block its replication inside the cell. And so that's how antivirals work. And the question, I guess, is, are there any antivirals or medications that are effective against COVID-19? There aren't really any proven therapies right now, but there are some promising drugs that are being tried. And I think the antiviral that is most promising is a drug that was studied in the past for treatment of Ebola. But unfortunately for Ebola, it did not work. So the quickest way to get to a therapy because of the pandemic is to actually repurpose an existing medication that did show some activity in earlier trials, but not in the midst of the Ebola epidemic, is to try it in patients who are exposed to this new virus. And the drug is called remdesivir. It's actually a company called Gilead that's making it. And it's now available in clinical trials. It's being tried. And the evidence so far has not been very positive. The study that was done was actually in China, and it was few patients. There was some suggestion of improvement, but larger trials are required now to show on a large number of people who are infected whether it works or not. And so for that reason, remdesivir, that originally was really for Ebola, is a promising drug that is being tried now even by the World Health Organization in large trial called Solidarity that's actually ongoing right now. So we have something to look forward to in terms of an antiviral. In terms of other therapies, there are other therapies that are being tried as well, and these are antiviral drugs that have been proven to work and are actually being used for HIV. And there are some candidates that are being tried now in large-scale trials to see whether they actually work. So to make it shorter, the discovering new drugs from scratch and taking them through the development program usually takes about 10 years. So the current thinking is to try to repurpose existing drugs for which we have a lot of experience, either treating other disease, or we know that they have advanced in other clinical trials and other clinical studies. We understand the safety profile of the drug, and it's just being tried now in the last stage of a clinical trial, which is a phase 3. So it is trying to shorten the time to get an effective drug, or maybe it is not effective, but at least it gives us the evidence that we need to be able to use it on a population level.
So what is currently being used in the hospitals as far as drugs to treat those infected with COVID-19?
So there is no specific antiviral, as I said. The current program does allow, per approval of the FDA or the European Medicines Agency, to get the drug under what they call emergency use authorization, which means for life-threatening conditions like COVID, where we don't have any treatment, it's really for the very small percentage of people who end up in the ICU who can't really breathe on their own, they go into a respiratory distress. That it is being allowed now to be used. Your doctor who may be involved in a clinical trial that is approved by the FDA could actually request a drug from the company that makes it, and then it can be given to those who are really critically ill. Right now it's not available, it's probably not useful to actually make it available to everybody who gets infections from COVID-19, because we really don't have good evidence of effectiveness and safety if it's used in a large scale. So it is really a compassionate use scenario, and doctors or hospital settings where the trials are going, and there are many trials going on around the globe, and you could actually get that in the hospital setting, not outside. That's sort of the antiviral.
Okay.
For other treatments, of course, they are mostly supportive treatment. People, if they end up in the hospital, they will get oxygen therapy. If they are unable to breathe on their own, they may be put on a mechanical ventilator. So that's why there's been a lot of talk about having enough ventilators, because there are a lot of people who may end up in the ICU needing that kind of support. And that is in an ICU setting. It's not something that you can give in an emergency setting or sort of a normal hospital ward.
Well, there has been a lot of buzz regarding hydroxychloroquine and chloroquine in helping fight the virus to the patients that are in the hospital. There's sufficient evidence of its effectiveness, safety to humans.
You're right. There's been a lot of buzz about hydroxychloroquine and chloroquine. Chloroquine, of course, has been in use for a very long time, and medical professionals are familiar with it, and it's very well-known safety profile in the treatment of malaria, and in the U.S. for a couple of other conditions that are chronic disease like lupus. So when a drug is actually studied and approved, it's approved for a treatment of a particular disease at a particular dose, particular route of administration. And so that is all studied and determined before it becomes available for physicians to prescribe it. In the case of chloroquine or hydroxychloroquine, they have not been really studied in what would constitute to be a substantial evidence study, which is like a randomized clinical trial where you get the best evidence of effectiveness and the best evidence of safety of a drug when used for treatment of a particular disease. The evidence that we have seen that has caused so much, interest in chloroquine is a small study that was done in France. It was given just to about, 36 patients, and there was some improvement in some of the cases that were treated with chloroquine. So out of the 22 who actually got it, about 6 of the patients in the treatment group were also prescribed azithromycin, another antibiotic, not an antiviral. And they claimed that, it was beneficial to the patients, but there were also patients who got the treatment who they did not know what the outcomes were. So in scientific evidence evaluation, this kind of study is considered to be inadequate because it's just few patients and it's not really meant to show definitively whether the drug works or not. So right now, then there was another study from China, and that was actually reported in February, that revealed the treatment of over 100 patients with chloroquine phosphate. They claimed that it had resulted in significant improvement of pneumonia and lung disease with reductions in how long people stayed in the hospital. But that was considered again to be small sample and also not a randomized clinical trial. So this evidence, although not conclusive, is suggestive enough that now large-scale clinical trials are being done on a global level, both in the U.S. and in Europe and also in Asia. So we may be able to get some definitive proof whether it's actually effective. Maybe sometime later in the summer, if they have actually enrolled enough patients into these clinical trials.
Great, thank you for that overview. I was wondering if we could kind of bring things to the ground by inviting Dr. Hanna, our infectious disease specialist, to give us some insight to what she's seen and what she's seen as far as use, treatment.
Thank you for having me again. And, most of the medications that are used already have been talked about, and I just want to give a brief explanation of what ICU patients are like. So when somebody cannot breathe on their own, and they do everything really to help that person breathe on their own with different kinds of, support, but when that person can no longer maintain the required amount of oxygen, we call it oxygen saturation, and at that time, that person is really at risk for possible death from lack of breathing, and then that's when patients are tubes put in their lungs or to support the breathing, meaning that if possible, the patient would breathe, otherwise the machine will breathe for the patient. And so that's the mechanical support, and then you need that like Dr. Solomon said, that would be in ICU. And not only that, but there are so many other things that happen in intensive care units. And so the treatments that are being used currently right now is, like Dr. Solomon said, before patients are in ICU, actually when they're on the floor, when they come in with respiratory problems and they know that they are COVID-19 positive, then they're treating them with hydroxychloroquine in combination with Zithromax, depending on what the risk factor of that person is. So who's at risk, high risk, as we have heard earlier? People over 55 and other medical problems such as diabetes or cancer, immunosuppressive things. And so those people are high risk, and so they tend to give both medications for these high-risk patients. And Dr. Solomon said this is basically a presumptive treatment. It has not been proven whatsoever that it as a curative treatment. And then also the next step is the same thing with Demdesivir, which is also available, but that is on a treatment trial or compassionate use. And some of the time that what they're using in ICU is basically also Kaletra or Ritonavir, which is an anti-HIV medication. In some cases, they're using interferon B, and also they're using statins, which are used for cholesterol-lowering medications. And these compounds have what we call cardioprotective features, which means that they provide some sort of protection to the heart, and they do that by modulating the immune system. And so they are using those things as concoctions of other medications to really support those patients. So what are the side effects with these treatments? Well, at this time when a patient is in ICU, then we're talking about benefit versus risk. We don't really care about the profound side effects, because if their kidneys are, affected, then we can improve some of the things. But the effort is to save that person's life, basically. And so, yes, these medications have been used, majority of them on outpatient basis, especially hydrochloroquine. In Africa, it's been used for many, many years for malaria, and because of the drug resistance for the chloroquine, that we don't use that as much. But also here they use it, Plaquenil we call it, for different autoimmune diseases. And so we do have an okay safety profile. And then, of course, the Ritonavir or the Kaletra, we don't use it that much, but it has been the working horse in HIV care for many, many years. And the Lipitor, of course, we just watch it. And so in the stage of ICU, we kind of like to kind of put aside the side effects, and we try to do everything to save that person. Great. Thank you, Dr. Hanna.
Well, can I add something to this?
Sure.
Yeah. So I think in terms of, I just want to speak to chloroquine and hydroxychloroquine, because they're actually available for malaria, so doctors can prescribe them, or in other places, you can actually get chloroquine from a pharmacy where there's no strict control. So this medication is not without its own toxicity, especially concerning heart problems. It can actually cause a heart rhythm disturbance that can be sometimes fatal. More so if used in combination with azithromycin, as has been talked also in the media. So there's a lot of caution that one has to exercise. So that's why it's only for COVID-19 to be used really in the hospital setting and not to be taken outside the hospital setting. And also has to be very careful in terms of people who have liver disease or kidney disease, because we don't really know what the effective dose is, if at all, chloroquine, hydroxychloroquine is effective. So it's always a good idea to consult with your doctor if you should take actually chloroquine for COVID-19. It's not advisable to self-medicate. I don't have that much concern about remdesivir because it's still experimental. You can't really get it going to the pharmacy or have a doctor prescribe it and you get it from the pharmacy. It's also not very easy to use because it's not an oral medication. It's actually to be given directly into the vein. So it is less available to people to just take on their own. Thank you.
Thank you for highlighting the importance that hydroxychloroquine, chloroquine aren't to be used at home, taken from the pharmacy, that this is something that requires medical attention, medical professionals, as there's still some uncertainty of the exact dosage.
If I could just, from what Dr. Hanna and Dr. Solomon were saying, is that once you get to the ventilator, once you're in the ICU in the ventilator, the majority of people end up dying. So it's, at this point, you're trying, just to do whatever you can to save their lives. And I think some of the numbers that I've heard is, so the 80% that do okay at home, they don't really need to be hospitalized. Then the 15 to 20% that may end up in the hospital, and out of those that end up in the ICU, probably about 25% out of those that are admitted to the hospital will end up going to the ICU, 20 to 25%. And once somebody is intubated, probably about 20 to 30% end up surviving. So the majority, so it's extremely important to not take all these preventative measures, not to be lax about that. It's really important to do all that we can to make sure that we protect ourselves, we protect our loved ones. And also, there's so many things that we can do to make sure that we are healthy. Just because you stay home does not mean you're not going to be active. So stay active, stay hydrated. Vitamin D, making sure majority of people are low in vitamin D. Vitamin D helps with increasing our immune system. So taking the appropriate dose of vitamin D. So, pretty much everybody should be taking vitamin D supplementations. And also making sure that we are eating healthy. If you're diabetic, make sure that you're really following your blood sugars and really controlling your blood sugars. So just doing everything that that you should be doing to stay healthy is a good idea to just keep your immune system as healthy as possible.
Mm-hmm. Thank you, Dr. Adiam.
Can I add one more thing?
Yeah.
So this is Hannah. So the one thing that I just really wanted to add, we our audience, we're anticipating to be young audience, and so the symptoms and signs that that were described earlier, and we really need to pay attention and not downplay it, okay? And then the other thing that was published online actually on the 30th of March, it was a study from Wuhan that involved about 206 patients, and these were basically patients that had COVID-19, and their presenting symptom was diarrhea or some sort of gastrointestinal problems. And so the GI symptoms that we say, nausea, vomit, it's new onset of diarrhea, nausea, vomit, or some sort of upset stomach. And these have been without any other thing. And sometimes 1 in 4, as they're saying, they just present as digestive symptoms. That means then if you check the stool is going to have COVID-19, okay? And usually 1 in 3 people will have also digestive and also respiratory, meaning breathing, anything that has to do with the breathing association. So let's pay attention to, okay, all the other things that we talked about, but diarrhea has to be included. Actually, this will be published very soon in the Journal of Gastroenterology very soon as an additional symptom for this disease. Thank you.
Thank you, Dr. Hanna. So we'll go into all of that a bit further later in the Q&A. For now, I want to circle back to Dr. Solomon. I was wondering if you could tell us a little bit about plasma and its use for COVID treatment.
I can talk a little bit about it. Plasma usually from recovered patients, that is from people who have the infection and they recover, and they actually have antibodies that they have created in the blood. So the blood usually, when it's taken from the patient who is completely recovered, is really teeming with antibodies that may fight the virus, because they have recovered. Most people are recovering because they actually were able to fight off the infection. The part of the blood that contains antibodies is called convalescent plasma, has been used for decades for other treatments, even for Ebola and influenza. So there is at least a precedent for using plasma from recovered patients. However, it's a little difficult scientifically to know how valuable it is in any disease setting. So until one is actually studying it in an actual patient suffering from COVID-19. So now there are actually opportunities to use it, and some hospitals have used it in New York, and we still have to see whether it's been actually effective in either stemming the disease or reducing the really severe consequences, even death. But at least, scientifically, there's a good precedent for using plasma. And recently, just the FDA has approved the use of convalescent plasma to be used in patients with very serious condition who are, with life-threatening COVID-19 infections. This is still considered to be experimental, so it has to be done under a protocol. One has to be careful, of course, in the hospital setting. Doctors have to make sure who is donating the plasma. They have to meet several criteria. They have to have tested positive for COVID-19 and they've recovered. They must have recovered and have no symptoms for 14 days. And they currently test negative for COVID-19, must have high levels of antibody in the plasma to be useful. And a donor or a patient must also have compatible blood type. Once the plasma is donated, it is screened for other infectious disease such as HIV. So it's only after that it can be used. This kind of plasma actually obtained from one patient can be useful to treat 2 to 3 people whenever it's available, but it's still experimental.
So the biggest question that we seem to get is, when can we expect to see a vaccine available to the public? Right.
That is a big question, of course, everybody is interested in knowing. Normally, if you are to start from scratch, in developing a new vaccine, it takes 10 years or more, because you have to go through all the different testing stages of the drug. You absolutely have to make sure that it is safe and effective, because once a vaccine is given, and you have to give it to a large number of people, and it's a whole population. So, even if it has a safety problem that affects only 1% of the population, once you give it to millions of people, that's a huge number of people who will have a negative consequence of the vaccine because it's unsafe. So currently what is being done, and there are really promising technologies that are being used to speed up the development of the vaccine. And the experience is, again, similar to sort of the drugs that are being developed. Are there any vaccines that have been directed at viruses that in the recent past had actually caused similar outbreaks? And there were actually 2 of them, as you know, that in the last 10 to 15 years. One is another coronavirus called SARS that also originated in China. It's a different strain of coronavirus. And then there's also another one which is called MERS that actually started in the Middle Eastern countries, caused very high levels of death in that region. They all are sort of didn't go into a pandemic setting, but they did cause quite a bit of a problem. So there were actually some vaccines that were being developed for that, and once the SARS and the MERS epidemics were under containment, there was no need to develop them further. So now they are being repurposed to see whether they can be effective against this new coronavirus. And so for that reason, that's why there's a thinking that we could develop this vaccine in 18 months or so. That is an incredibly short timeline. I have never come across any vaccine that has been developed in 18 months. But the hope is that since we've had a lot of experience experimenting with this in the medical community, perhaps there's a chance that if you go through the trials, because there are large trials going on right now, perhaps we could get results in a year, 18 months. Whether that would be evidence that will show that the vaccine is effective is another thing. But at least we will get some results from all this, almost 35 plus trials that are going on around the globe. And we will be able to see some results that whether tell us it is effective or it's not effective. And that's the reason why the 18 months. There is hope.
Great. There's hope on the horizon.
Yes.
Great. So I want to open this final question to Dr. Salman, Dr. Hanna, and Dr. Adyam. Based on the complexity and mutations of COVID-19 that we've seen happen, will this likely be a seasonal vaccine that comes out?
Let me talk a little bit about whether this is what kind of vaccine it will be. It is at this time really not known because we've just had 3 months of experience with this infection. To really determine if it's seasonal, at least you will have to see another season of the infection. So there are 3 or 4 ways that this infection could progress. One is in the summer months, it's less virulent or it's not as prevalent as the cold season, but so far the evidence doesn't support that assumption. Or it could actually just take root in the various countries that it is actually spread and become a low-level infection, and people build immunity to it. And some people will get sick, so it becomes an endemic disease. Or it's completely, we get a vaccine next year and we're able to protect a large number of the people. So whether it's going to be seasonal vaccine, or whether it will be a one-time vaccine is yet to be determined. As you know, for example, for flu, we take it every year. And the reason is the strain of virus that is responsible for the flu does change in its composition from year to year. So we always have to play catch-up in formulating a new vaccine that has effectiveness against the circulating flu virus. So we haven't seen really a lot of mutation change over 3 months in how the virus behaves, the coronavirus. Hopefully it doesn't really change from season to season so that we have to make vaccines every year, a different one, but that's yet to be determined. So there's a lot of uncertainty about what the future is. But at least what I can say, the good news is that we have experience from dealing with different viral disease, and the type of technology and medical research could, I'm hoping will actually catch up with the tricks of the virus, so to speak, as it moves along in the infection cycle.
Great. Thank you, Dr. Solomon, for highlighting, yes, there is some uncertainty. However, there's a lot of hope based on what is being researched globally. I want to thank you for your time, and we'll come back to you later. For now, I'd like to move forward to Dr. Tsaigai, our psychiatrist on the call, to get some context as to the mental health issues prevalent in our society. Dr. Tsaigai?
Thank you. Thank you, Winta. Thank you, everybody in the panel, and everybody that is tuned into the podcast today. It's, of course, a broad question. The COVID-19 pandemic knowingly has been and will be posing a range of challenges, including psychological ones on all of us for sure. But the impact of these challenges on our mental well-being will still be depending on how individuals, a group of people, and countries will be coping. And we'll see the rate of the spread, for instance, that many countries have been dealing with the pandemic in many different ways. I will quote Dalai Lama here: if a problem can be solved, it will be. If it cannot be solved, there is no use worrying about it. It's no use worrying, at least worrying too much. We need anxiety or normative fear that causes unpleasant feeling of uneasiness or worrying in times like this. That will prompt us to behave cautiously. That will help us to consider or abide by norm-based social regulation. In times like COVID-19 pandemic, this is going to be very important. For instance, how do we accept the need for quarantine or social distancing? So currently it is normal to be anxious or worried. It's not a time to be fully relaxed or complacent. In fact, being complacent about COVID-19 has become a punishable act in many countries. Norms do change, and it's about us adjusting to the changing norms and requirements. This is a time like no other. Almost no one in the whole world is talking about other issues but COVID-19 pandemic at this moment in time. The threat to the whole world is imminent. Any other pre-COVID hot topic look very minor at this moment in time. This time makes the world look one, the planet so small, like a rocking boat on which all humans are sitting. No matter who they are, where they have come from, no matter how wealthy and how poor. COVID-19 does not discriminate. As we had said in some of the previous podcasts, there may be a blessing in disguise in here, in this potentially tragic, but for sure very scary times. We humans may get good lessons out of this unpredictable phenomenon. Mentally, COVID-19 is taking toll on people, all of us. Most surveys have been showing that the majority of people are finding it very hard to stay calm. This situation is having a negative impact on their mental health. There are major life disruptions, and mental health risk is at all-time high. Human mind cannot deal with uncertainty very well. After 3 weeks already, people are asking, when will this end? This may be a very familiar experience for many Eritreans who have lived through daunting and scary times before. Eritreans who felt disempowered for some or much of their pre-diaspora time. Many of Eritreans will be dealing with a pre-existing post-traumatic distress that may exacerbate when facing yet another palpable threat. This pandemic seems to threaten the life they have built with hard work for the better future. The majority of them never had a head start. They came as refugees with nothing but bare clothes on. They have worked 3 to 4 jobs. Now the idea that one virus will potentially undo all that and their hope for the future must simply be very scary. Not again is the feeling that may come through their head and mind. No surprise then that many of Eritrean people will be inflicted, beside the potential exacerbation of PTSD or other pre-existing mental health issues, with new onset of real-life anxiety or depression, insomnia, and other mental health challenges. Maybe also an increase of adverse life choices or habits, increase in use of alcohol or use of drugs, binge eating, etc. People are worried for their health and that of their loved ones. Social distancing, quarantine, for people that are markedly sociocentric, will be expected generally to add more distress, since there will be many who have not had that much exposure to the modern social media, potentially. Now, to quote Robert Kiyosaki, inside every problem lies an opportunity. We're talking about deciding between worst-case scenario and best-case possibilities in the other podcast. This is an opportunity for us as a society to start talking about mental health, maybe to think about stigma and discrimination, chronic discrimination against people who have mental health issues. As WHO says, without mental health, there is no health. The step one in this time would be to open up. You're not alone. 1 in 5 people go through mental health issues at least once in their lifetime, according to the WHO statistics. In times like this, you'll naturally expect that there are more people struggling with their mental health, confusions to make sense of what is happening suddenly. And when you add substance use disorders, you would say that perhaps around 970 million or more people in the world were struggling with mental health issues in the year or up to the year of 2017. This adds up to almost 11% of the Earth's population. We as people have to decide, are we different? No. We have any type of vulnerability that any other people have too. Dr. Menges has said in one of the podcasts, Speak Out, it's about time to speak out about mental health. It is okay to be scared. Anxiety and depression are on top of the list for mental health disorders. Around 4% of people struggle with anxiety issues and 3.5% struggle with depression. And this distribution will apply for any country and any people, with some variations because we have to differentiate between life situation related to mental health issues and so-called functional mental health disorders. So those who are struggling with mental health, you would say they are not alone. Reach out to your loved ones, to people that you trust. If needed, reach out to professionals. Talking about things that bother you helps. Debriefing is seen as unloading a weight that you don't need. Take the signs of your body seriously. Don't brush them aside. Listen to your body, because the mental health has a way of telling you through your body that something is not right, that you have to deal with. If you have your heart rate up, blood pressure is up, you feel tense, you can't sleep, you're worrying excessively, you're feeling overwhelmed, you feel upset easily, it's time to recognize that you don't only have a body that can be diagnosed with the usual diagnostic means. You do have mind and perhaps even soul that are very abstract. It's okay. This is not a sign of weakness. That's a human nature. Take an action and you will see you will get better. Remember, there's no problem outside you that is superior to the problem within you. That is Bob Proctor. An opportunity may have arisen in this current situation to finally talk about mental health in our society as well.
I want to thank
we
you.
We have suffered from mental health problems, and it needs to be said to those who have suffered mental health problems. It needs to be said it is not your fault. It's human nature. As we accept body disease, we have to equally accept mental health conditions. Back to the COVID-19 pandemic, unplug, have a break from constant barrage in news and social media. Use only reputable sources for information. Avoid delving too much into scary conspiracy theories. Remember how many conspiracy theories you have already heard about nearly any major part of your life. What did they serve to? Remember, they may be just a result of our inherently suspicious and restless mind. Follow advice on prevention. Those are recommendations that have been given in this podcast again and in the previous podcasts as well. Physically distance but virtually stay connected with loved ones outside your household too. Phone or video calling or usage of other social media. We can't do nothing to change the current requirements around COVID-19 at this moment in time, so accept them. That's what's being recommended. Accept things you cannot change. Worrying is not going to make any difference but cause more distress. You can only change what you can change. Don't dwell on the chronic problems. Create distractions for yourself and your family. Get a routine for family activities. Plan together for activities you all enjoy. Read books. Watch favorite movies. Engage in old or new hobbies. Exercise regularly. And as a parent, you have to remember to be a role model for the children that usually learn from what they see. Keep regular sleep and exercise hygiene. Eat healthy and connect with friends and family members on a regular basis. Avoid excessive use of alcohol and avoid using drugs. Avoid comfort eating. If the situation is beyond your reach and ability to manage, do not hesitate to reach out for professional help. to call mental health and psychological services. Thank you so much, Winter.
Thank you, Dr. Tsagai. Just to recap some key points that I think you mentioned, beyond the, of course, trying to maintain a healthy day-to-day as we go through this, is one, we need to adjust and not become complacent in this global threat, being open to discussion about mental health issues, about how we're doing, stay close with those that we trust, reach out to those that we care about, and most importantly, it is not your fault for experiencing any kind of mental health illnesses, issues. And so I was wondering if you could elaborate a little bit more on the intergenerational mental health concerns in our community.
Yeah, that's a very important question. There has been done a lot of studies and vast literature as well that we would let us expect that there must be or should be international effects of traumatic experiences in our population. For what we have gone through, our parents, grandparents have gone through since the colonial era and after, with forced escape, social disempowerment and dispersation, we can expect a higher rate of PTSD, of course. However, we do realize as well that stigma is a significant problem in our society. We have culture-specific explanatory models around mental health altogether that are often at least not helpful, if not at times dysfunctional or detrimental. We have mental and emotional wounds that we as people may have never had an opportunity to talk about, to discuss. And I cannot remember of any kind of discourse upon our past traumata. These wounds will have affected us in ways we may not actively notice. But according to the studies that are out there, despite us being in denial, in some ways they would be expected to have somewhat affected the offspring, the younger generations that had not had a direct exposure to those traumatic events. It seems to be recognized that you don't have to be directly exposed to a traumatic event to have or to develop PTSD. So the DSM-5 has changed or redefined PTSD. Previously, it was said that PTSD was a result of a direct trauma or a directly experienced traumatic event. Now it was changed to also witnessing traumatic event in other person or learning that had occurred to a close family member or close loved ones. PTSD causes intrusive symptoms, so those who have suffered from traumatic events, and these were quite rampant in Eritrea, they will be re-experiencing all those past traumatic events in many different ways. It could be nightmares, flashbacks, thoughts or images of the traumatic events coming over and over to haunt the person and causing potentially ongoing or intermittent distress. And in times like these, you would expect that there would be triggers that will cause an exacerbation of PTSD, and you would encourage people who've gone through those experiences to be open to the possibility of having a mental health issue that's called PTSD, and either talk to people that you love and trust, or if that is beyond the ability of yourself and the people that you've asked for help, to look for professional help, to not keep wounds in, because they will have ramifications not only for you but also for the people around you. They could easily become intergenerational and affect even the grandchildren and great-grandchildren.
Thank you, Dr. Tsagai. Thank you all so much. We have questions that have been emailed into us. So at this point, we'll be opening up the phone lines for the public to join in for Q&A. First, we're going to start with some questions that were emailed to us by participants. For those of you that do have questions and are on the line, please press *6. Take some time to think while we answer this first question. Briefly state your name and question. For now, great. Dr. Tsagai, so the most popular question that we have is, fear and anxiety seem here to stay, and our culture response may not be as open as that of many others. Are there any tips on how to cope, and how do we talk to our young members of our society?
Thank you for the question. Yes, that's a major issue in our society. If somebody talks about feelings, it's being interpreted as a weakness. We don't have culturally a concept of, in fact, talking through issues that we face in our day-to-day life. And there are, of course, traditional explanatory models that don't help, that are of superstitional, I would say, background, or based on assumptions that have been given from one generation to another, and have been found to be, of course, unuseful. You would hope that we would move towards a more evidence-based discourse about issues that apply for all of us, for our kids, especially now growing in foreign countries. It's very important for parents to remember that kids' issues are universal issues. Mental health issues are universal issues. It's nothing to do with you. Don't take this as an offense. Don't take this as something that you should feel ashamed about. Don't process these with guilt. That comes first in humans' mind overall. This needs to be seen at the end as normal human suffering. And the one thing that always surprised me is, why can't we get to the point of saying, all right, every part of us can actually struggle at one point in our lifetime. It can be our mental health. We have different dimensions as human beings. The physical dimension is only one, and the physical dimension may not even be really the most important one. So we need to think about it. We are more than just a body. Human beings are more complex. We have mental health needs, and spiritual needs, and all other needs that are so abstract. So we need to keep our ears open and listen to the people that have got to say something about themselves. One thing that I would like to mention here is, in our culture, we tend to give advice after advice. And I think this is really what we need to look at. One of the major core issues in therapy is, if I give a recommendation or an advice without being asked, where do I get to? In fact, it's really meaningless. So we parents need to learn that we can't come up with all the great recommendations and not listen to the kid. That's where issues occur, especially when we live outside of our country, where the village raises a kid, and all the neighbors take part in how I get raised, or uncles and aunties, whereas here we are pretty much left to our own, and we try to apply the same raising techniques as we've known back home. And this is really where we need to open up our mind and think that this is not really working. Let's just keep an open mind and get the kid to talk about their issues openly and welcome them without judging or giving quick comments on their feelings.
Thank you, Dr. Tsagai, for answering that and highlighting how critical it is to take this all in with an open mind as we try to understand where each other are coming from, these different generational backgrounds. At this point, I do want to open it up to those joining us from all across the world to see if there are any questions at this time. Reminder to press *6, state your name and question.
Hello, sure. My name is Haptu. Well, it's not a question, but I have been wanting to do this for the last 3-4 weeks. Our great physicians, they have been educating us. If you give me quickly, I want to take it out of my chest. I'm so excited. I'm so happy. So let me say this to all the doctors who have been include educating us for the last couple of weeks. I would like to say thank you. Thank you for your willingness to take the time to address our confusion. and fear of the unknown at this time, at this scary time. Explain to us in the language that we understand the best in Tigrinya. Thank you. And today, for you to take the time to speak to our children with the language they understand, I'm so grateful from the bottom of my heart. And I'm grateful on behalf of all the listeners right now and who are not with us. I am particularly grateful to Dr. Mengs Bairu. Thank you, my baby brother. I'm really proud of you. You're representing all the Eritrean Medical Association in this world, in this country. Thank you for providing us this amazing time, literally one-to-one base. I'm so grateful.
Thank you, Tsaika.
Oh,
thank you.
As the last,
thank you.
Thank you.
Thank you.
Winter.
Do you have a question?
Yes, this is just one day. Thank you, Winter. Mengus Bairu. Okay. My God, okay. The apple does not fall from the tree. I'm done. I swear I'm very proud of you and your contribution. Thank you. History will remember you. I love you from the bottom of my heart. Thank you.
Thank you.
Thank you.
Do we have a question from the public? Reminder to press *6. If not, we'll go ahead to the next question from our email box. Will shingles vaccine help fight COVID-19? Are the rumors about shingles vaccine having capacity to fight such accurate? Dr. Solomon, if you could touch on that.
Shingles? Is that what you said? Shingles vaccine?
Yes, the question was, are the rumors about shingles vaccine having capacity to fight COVID-19 accurate?
No, there is no evidence to support that notion. So there is no study or there is no scientific data to support that shingles vaccine actually has effectiveness against this coronavirus.
Now the next question from Leah. For those of us with kids, what is the recommended fever-reducing medication to have in the house? For example, is it true that we should not use Advil, Motrin? If Dr. Adiam or Dr. Hanna could speak on that.
And Dr. Hanna, you can add to this as well, but Tylenol is definitely fine. There have been some people or maybe studies that questioned the possibility of adverse effects from ibuprofen, Motrin. However, I think that has pretty much been dispelled. However, I think it's always a good idea to start with the Tylenol, and if you still if the fever is still elevated and you've already given the necessary dosage of the Tylenol, then you can supplement with the ibuprofen.
Dr. Hanna, is there anything you'd like to add? Okay. If there's no questions from the public, the next question is from Dr. Johannes. His question is, there is a sentiment that coronavirus does not tolerate heat, and that might explain on the low infection rate in Africa. If this is the case, use of hot water for washing and drinking might help. Can we encourage people to use this since there is no harm for such use? Dr. Adiam, if you'd like to go ahead and answer that.
So, whether it doesn't do well in hot weather, I think Dr. Solomon mentioned that that's probably not true. It could be true. It may not be true. It's not really clear. I think in a lot of the infections have been in the colder weathers, but we definitely see it. We're seeing it in Africa, in other warm areas as well. And I think there is, Dr. Fauci did mention that there is some hope that maybe in the summer months it may decrease. So again, this is really about transmission. It doesn't the transmission rate and things like that. So your body, you can't really kill it by drinking hot water. I don't know that is going to. I think you just being healthy, doing what we said, making sure you're adequately hydrated, and doing the necessary things to prevent. And then if you do catch it, making sure that you are doing everything that's necessary to keep your immune system up. Healthy eating, all those things, making sure if you have diabetes, your diabetes is well taken care of, you're taking the other medications that you're supposed to be doing. Those things are going to be helping you more than, so drink the fluids. I don't know that it matters if it's hot or not, but if it makes you feel better, a sore throat and so forth, and you want to drink ginger, a hot tea and so forth, and that's fine. But I don't know that there's any data showing that, hot water or other things are really going to help in fighting the disease. If somebody else has any other information about that, please join.
Yeah, I think you're absolutely right. Remember that we've had only 3 months of experience with this virus, so we don't have the benefit of learning a lot about how it behaves in hot weather versus cold weather. But what I can say is that the world right now is affected by COVID-19. And there are no countries where there are no COVID-19 infections. There are some regions that are actually not in the cold season, but actually more in the sunny, hot season. They still have had the experience of getting the COVID-19 infection be introduced into the country. So the evidence is not that strong that season actually has much effect. But again, we just had 3 months of experience, so we'll have to see. We'll have to have many months of experience, even a season to pass to know exactly whether that's the case. The second thing I would say is, the most important thing is really the soap. When you're washing your hands with soap, and if you can use also hot water, that's good. But it's really the soap that makes a big difference. The soap does have an effect on the envelope or the cover of a virus. It's actually a fatty envelope that it has. So the soap actually has the effect of disintegrating the fat and destroying the virus. Besides just removing from the surface of your hands and your clothes. So washing your clothes, often, after you've been outside, especially if you were in the presence of an infected person, and immediately washing it does help, seem to remove the virus, kill it, and protect your family members who are in the household, and protect others from being infected from you, or even yourself if you were just touching your face, your hand, or your eyes, or your mouth.
So this is Dr. Hannah. So I just want to add to what Adiam said. So it's all as they call it, fake news. Drinking hot water or hot shower or whatever have never been proven to be anything. As with the flu season, that when you drink hot water or hot containing thing, it kind of gives you a relief of the symptoms. Perhaps nasal congestion get better, and you're hydrating really by drinking a lot of hot water or hot tea. And so that basically is a symptom relief as opposed to any treatment really. And there has not been anything to really indicate that it fights COVID-19.
So moving forward, speaking to our youth especially, as well as chronic smokers, what is the impact of smoking and vaping on the disease? Dr. Hanna, if you're ready, if you could answer that.
Yes. And so, smoking never really helps anybody as it is, and it creates lung disease. It causes lung disease, whether it's a long-term or even in a short-term period. And so there had been associating of severe diseases with young people that are smoking or are vaping. And so when we talk about smoking, it's not only cigarette, but it also could be marijuana or any other smoked agents that are around. And so really it would not be a wise idea at this time to really smoke at all. And as we know, this is for a young audience mainly, we may think that it's after a long time that we develop lung disease, but we've had issues with young people that are having serious lung disease. One of the things that even though young people may not die as much from complications of COVID, but they're showing a lot of horrible lung disease as a consequence. And so I would completely advise on avoiding using any of these things.
Great. Thank you, Dr. Hanna. So we have a question here for Dr. Solomon. A couple days ago, the BBC and other mainstream media outlets have reported that a French doctor had suggested that BCG, a tuberculosis vaccine, be tried in Africa to see if it would be effective against coronavirus. Allegedly, his words were, "Shouldn't we be doing this study in Africa where there are no masks, no treatment, no resuscitation?" A bit like as it is done elsewhere for some other studies on AIDS. In prostitutes, we try things because we know that they are highly exposed and that they do not need to protect themselves. So the first question, a two-part question, is why is BCG being considered for COVID-19?
Yeah, I don't think it's being considered. This is actually the first I'm hearing about BCG being considered as a vaccine for coronavirus. But having said that, BCG is really a very different vaccine, and the mechanism is very different. And TB is a bacteria, not even a virus. So it doesn't seem to be something that a scientific community would be considering, given that the disease is very different, the vaccine is very different, and the agent that causes it is very different. So I would say, not having seen the report and what the basis is for that report, what I can say right now is it makes no sense from what we know about TB and BCG through many, many years of experience using it.
Thank you, Dr. Solomon. Dr. Hanna, I know TB is your area of expertise. For the second part of the question, taking into consideration the Tuskegee study of untreated syphilis with African Americans and other racially laced experiments, do you see any danger the West might use against Africans as guinea pigs in this rush to use a vaccine for COVID-19?
Well, I mean, there's always somebody that wants to make a name for themselves, and it's not like we have not seen it. We see a lot of that in pregnant women, for example, in HIV in the early days, randomizing whether to give them, medication versus not medication. So there's a lot of things that is done, even in post-exposure prophylaxis, meaning that exposing to prevent exposure to HIV in prostitute or anything like that, and knowing in some cases that some of the medication may prevent, and they went ahead and did a double blind where some of them get infected. So it's not new that the West does to Africa, and so I think we have to be very careful. I mean, BCG, what dose are we talking about? BCG is already given in a lot of the world for prevention of TB, tuberculosis, and so I don't know. I'm just actually looking at on my computer to see. It's just one doctor proposing in France, and I have heard about it a couple of days ago, but I don't think it's going to go anywhere. But I don't think Africans as primitive as they think we are anymore. I think there's a lot of people that are really against it if it's to go. And so I don't think, the other scientific world would also allow anybody to do this unethical study. So I doubt that would happen. But I wouldn't be surprised if somebody would do it on the side.
Thank you, Dr. Hanna, for answering that. We have two questions on the line. If you could go ahead and press *6, and we can hear your question.
Hi, everyone. My name is Blaine, and thank you for your time. It's been great listening to you all. Can you all hear me?
Yes.
Okay, perfect. I have two quick questions for you. The first question is, as you know, there is a shortage of supplies, and many people are struggling to get sanitation things for their households. And let's say we get to the point where we don't have washing soap or sanitation or bleach, which is what's happening in most households. What do you recommend using at home, or something that we can find, or if you know of places and community groups that are offering these resources, because I know a lot of people are struggling with that. And then the second question is, I've heard rumors that COVID-19 may be spread through food and takeout. So if you have any recommendations when we receive these packages, I've been trying my best, and my family has been trying our best to keep our distance and cleaning everything we receive, but it seems as if we can't stop getting delivery.
Thank you, Blaine, for your question. Dr. Adiyam and Dr. Hanna, could you go ahead and take these questions?
So as far as running out of soaps and alcohol or Clorox, I think there are a variety of things that are, I don't know, I guess it is possible to run out of soap, but really soap and water is pretty effective for your hands, washing your hands, and you can try and use alcohol. I can see alcohol sanitizers being difficult to find. However, there are a website, and I have to look and see, that tells you all the different things that you could wipe surfaces that actually have been found to kill the COVID-19. And let me see if I can find the website. It is, I think you may find it through the CDC, or
okay.
Let me address the other question as far as getting takeouts. It's easy to get boxes and certain things that come from the outside that potentially can have the virus, and so and I think I've also heard it online or on TV where we should be ordering, if you want something from a restaurant, a takeout, order Haptu. And so then what you should do is, wipe the box that it comes out, that they deliver it with, and then when you open it, after you open it, wash your hands, get fork or utensils from your drawers, and then use that to put it on a plate, and then put it in the microwave or in the stove or something. Like, for example, if it's a pizza, then you can quickly put it in the oven and warm it up, and that will kill the virus. So maybe cold food, salads, and other things that you can't really warm may not be such a good idea.
My question is about anyone that's still working, exposed to the public. They say if you had close contact with somebody in your clothes or your mask or anything like that, to put it in a dryer for half an hour. Is that a good thing to do, or does that kill the virus?
Dr. Hanna, if you could take this one.
Sure. Or they say you can leave it outside, in a dry area for a couple of days. Definitely heat will, that dryer is, not only that, you wash it. Make sure you wash the clothes, not just put it in the dryer. Wash it, and because there's a soap and water, and that cleans up and in a dryer. So not just sticking it in a dryer, okay? And if you have a mask, if you have a closed mask, you have to wash it every day when you come in. And the way you put it in, you have to be careful when you're at work, not to touch the inside of the mask, the closed mask. And there's a way that you can put it, just touching the edges and not touch your face. And clearly, especially when you take mass transit like buses or trains, and of course there's an issue with being exposed to COVID from touching the surfaces. I don't know if you remember a few months, we have said that the virus stays in plastic container for a couple of days, same thing with metal containers, which is, for example, the bars that you hold on a train. And so it's just make sure you wash your hands when you get there. If you can, put gloves on. I'm just all about gloves nowadays. And then, but when you come home, you got to take the gloves. And the same thing with your clothes. When you come in, put the clothes aside as soon as, and put them on the one side. Make sure you get ready for your home clothing, and then you wash those clothes, especially if you're working with a lot of people. And let me answer about one thing about the soap. I think you don't need to have any kind of soap. It could be just any soap, the old ways, the new ways, or whatever. And in terms of, cleaning material, it doesn't have to be this amount of that. It could be just, CDC said it could be anything that you usually use to clean for countertops in the kitchen or anywhere else like which we can't find right now. But I think just a plain old soap and water will do.
Great. So we'll take the next question.
Hi, my name is Marhawi Mahatun, and this question is for Dr. Tagai. So as a college student who is finishing up my freshman year, I've been trying to plan for this coming summer with internships and keeping my focus in school. But I've recently been feeling like I have to put everything on hold because of stress and fear that I've been facing during this time. So during this time of uncertainty, how do I remain productive and stay motivated?
Yeah, I get your point. Sometimes it feels that there won't be really an answer that would satisfy you or anybody who's going through similar life experience. It is a time where there's a lot of disruptions in our life altogether, and you as a student, having worked hard to achieve your goals and objectives, and suddenly something unexpected happened. As we were saying before, there is not so much you could have done different. It happened the way it has happened, and this is really beyond our reach. It is affecting the whole world. The economies and everything that is a major part of our life has come suddenly on hold. And I think the first thing, however, is to think about our health, because the greatest potential of us human beings is health. There's really nothing that would make much sense if our health was compromised, mentally or physically. Now, what do we do in this kind of situation? The day is bright still. You have your family around you. You are waking up and have in your core family at least everything intact. Because, as we were saying, Eritreans have gone through some life events that they can resort to. You are younger, and I think your parents will tell you stories. So there were times where things were happening arbitrarily. You don't know what you were waking up to. But this problem is shared by all of us universally. And if there was any reassurance here, then it is the fact that we are all going through this, no matter where we are at this stage of our life. And I think you can try to actually transcend to hope, because this is going to be past sometime. In few months, there were experiences of our people where it was not about months, it was eternity. You never knew when the tragedy was going to end, when it's going to stop, that somebody will come and take your son or a child. We've gone through all that. When napalm bombs are going to be thrown out of the air. We've gone through all that. So it is a different perspective for you, but you're privileged to be worrying about this, because it's a different place, a different world that you're living in. And there's hope I think you can derive from your parents, from the stories of your parents. This is something you will get through. Do the best you can every morning. Plan your day through, and activities, discovering, new opportunities for you. You have time, and the question is going to be, how am I going to use the time productively? I will plan for the day, for tomorrow, and the week, and next month. And I'm not going to spend my time worrying about what may have been if COVID-19 was not here. That is the way how I would see it, using the thinking brain. We're talking about it, rather than being immersed in sadness and worries about what could have been, because that is not going to get us, to a place where there's hope. And I wish you well with that. But I applaud you for achieving what you've achieved. It's great, and that is something nobody will take away from you. And knowledge and everything that you've learned, and that is something that you need to remember, in my view.
Thank you, Dr. Tsegai.
You're welcome.
We'll go on to the next question.
Hello? Yeah, hey. I had a question. I have a family member that tested positive, and it's been, I think, almost a week and a half, maybe 2 weeks. I'm just uncertain when it would be okay to go back home to see them.
Sure, I can answer that for him. So usually they say up to 14 days or so when the symptoms are resolved, but I would make sure that they have a test secure from their doctor before everybody is back in order, okay? And if it was the house that they lived in, it's so important to clean the house, basically clean everything. Hopefully that person is isolated. Isolating means that avoiding a contact with the household family members. And so make sure, the person that is sick, they talk with the doctor and they have specific instructions on what to do and when to join the rest of the family, okay?
Okay.
Next question.
And I think I got cut off earlier, but I did have a question. I think this is Blaine again. It follows to the question that the young gentleman just said. I have 2 family members who tested positive, and we're trying to gauge how to do the best or something as much as we can. I know we can't go near them at all right now, but what would you, for someone who doesn't have help or assistance, what would you recommend doing, or the best action steps you could recommend if someone's going to go over there and help them?
So how old is this person?
My aunt is, one of them, she's 70, and her son is 56.
And is she with her son or by herself?
She's by herself. They're both separately in different places, 2 apartments.
Oh, she's in an apartment. And so, is she self-sufficient, or does she need services before?
Yes, I would say yes.
She needed services before, right?
Yes.
Okay. So I think, I'm sure she has a primary care doctor, right?
She does.
Okay. So
they've instructed her to stay home. And the thing is, there's no one, they're not sure how to, a family member of mine is trying to find the best action plan to go and assist her.
Right. And so what you would want to do is this is what we were talking about in the past, if we have elder people that are living by themselves, or if they have prior services that were coming in, and then now that they had COVID-19, and so nobody's going to go, provide services. However, you keep a clear contact and make sure that there is no shortage in terms of groceries or food or pre-made food. And what you do is basically you explain to the person that why you cannot come inside the house, that why you have to leave everything outside. And as long as they understand that, if there is any, and then I'm sure the doctor probably is calling to check on her in terms of how she's doing. Is she okay?
She does.
She need to be hospital? She's okay.
Mm-hmm. She's having a few chills and, fever, and she's experiencing diarrhea at the moment. So.
Okay. Then I think what you need to do basically is make sure that the doctor's office should be able to help you in terms of to make sure she does not get worse, because she's elderly and she has several symptoms, that may progress, and so somebody really in contact need to check on her.
Okay. I just wanted to. Yeah, that answers my question. I just want to be prepared if there is another situation within my own household, what I would do in that case, because I don't think a lot of people know what to do other than, put your family member in a room. How can we better assist them? How do we not catch it? How can we, make sure they're healthy enough to survive and not just leave them, there? So I don't think a lot of people have answers to that. That's why I asked.
So to answer that question, when somebody's quarantined, a lot of doctors now have information, okay? And you can look at even online to say, what does it mean when you have a quarantined person, and how do you approach them? Because what it is that person is going to be really in one room, in one place. Let's say if it's a basement, in the basement, or they're literally going to be avoided from contact with each other, with other people.
Correct.
Hopefully they have the separate, bathroom, okay? And so you need to give them their food, provide them what they need, at a distance, but you don't share any utensils. It has to be all washed, okay? It doesn't mean just lock them up and just don't do anything, okay?
Great. Thank you. Thank you, Blaine, for your question.
Thank you.
And we have some others on the line, so if we can move to the next question.
So my name is Iyasu. Haptu, retired ID. I just want to, first of all, congratulations all of you. And we are proud of all what you are doing. Really, it's amazing presentations. But my question
Thank
is...
you. And your question?
My question is for Dr. Tsagai. For his handsome presentation is very good. Dr. Tsagai, I just want to mention now we are dealing, as you mentioned, with a very acute situation with all kind of things, losses and potential losses and fears and loneliness and financial stress. I think many people are unemployed by this time, So how do you deal with this acute situation with what is being done here? Is there an Eritrean version of what you call, or maybe you tried it, a group therapy or a support group or kind of a communication? I mean, my simple one is really phone call and Skype, etc. But can you express more? Because this is really what's going on now, very acute, and really, and many people, I'm pretty sure, are stressed out. Thank you.
Yeah, thank you for the question. This is really an unprecedented crisis that the whole world is dealing with. At least we're not alone. We used to be alone with all our worries. Remember our history. We used to be alone, left to our own devices. We have all these memories from our past, and I think we need to derive to those experiences. Those young folks, now Eritrean American young people, they have an opportunity to talk to their parents how they went through very, very difficult times, and it was a matter of decades. We need to remember, I do believe that we have a treasure of experience here. This is a time when young people can actually have a chat with their parents, all the things that we as people have gone through. We had a resilience. We went through it together, and against all odds, in 1990, it happened what happened, and I believe when we contrast our current experience, and that is what Folkman and Lazarus say in their work in 1980 is, it does matter where you've come from when you deal with new situations. And I think, our parents and grandparents are, if they are alive, God will, the living example of how you can go through times like these. This is a pandemic. Yes, it is something that you can't fight against. That's quite abstract. It's causing a lot of fear, but at least it's a common fear. It's shared by everybody, no matter who it is. And I think this can be slightly reassuring because everybody is doing their best to overcome this time of crisis. It's different. But I do believe that, as we were saying before, problems are there, and they will be always there in our lives in many different ways. And we are being tested right now, and it's about our coping skills, coping strategies. And I think it's good that we are opening up. This is an opportunity for us. We need to talk about what bothers us, and actually it's maybe one of the first times that we're hearing people talking about their fears and anxieties, no matter what age. And this is an opportunity for us. This is time when we'll talk to each other and support each other and distract each other and give hope to each other, because this is going to be gone, and we are all on the same boat, not alone this time. That may give us hope. And I do believe that when we keep ourselves busy distract ourselves, not dwell on the doom and gloom. We can't change this by worrying too much, by negative thinking. I think it's everybody's responsibility right now not to talk too much about COVID-19 all the time. I think this will cause a lot of stress. Talk about other things. Family sitting together, make sure that you plan the day. And that's very, very important, starting with a sleep routine and exercise routine and doing things that you never had been able to do because you've been working 2-3 jobs or you've been traveling. Now you're at home. Can you see in this something good, something positive? Finally, there is time. We never had time before. And time after health is probably the most important aspect of our life. How can we use the given time? Even the governments are allowing you now that has worked 3-4 jobs to stay home and get paid a little bit. I mean, this is something that we have not known in the history. So can we see something positive in this? Can we not talk day in, day out about COVID-19 pandemic? Can we change the topic? Can we read books, share something nice from the past, watch pictures, wedding pictures of our parents, or talk to the loved ones? We've now got time to talk to each other, and I think accepting is going to be a very important experience here. I mean, if we have not done it before, now we must. There's no other chance. We have to accept the situation, the social distancing, quarantine, and all that. But it doesn't mean that we are detached or disconnected. We had times where we were disconnected. That's our history. We were, we didn't have any way of seeing our loved ones. We've gone through that. And this is, I think, the background from which we can derive hope.
Thank you.
Thank you, Professor Iyasu, for your question. We'll go ahead on next question.
Yeah, I think that earlier I asked the question about running the clothes into the dryer. So maybe I should give more background. I was thinking about the taxi drivers and Uber Eats drivers. They're still working. They run around outside. They may not have the resources to wash their clothes right away. They may not even have washer and dryer at home, but they can stop by a laundromat and run it with a quarter into the dryer. As it was said earlier, the virus does not tolerate a high temperature, and running it through for half an hour does not get enough temperature or get enough heat to kill the virus. What I'm afraid of is that they would pile up their laundry until they have enough for a load. Maybe they're not the ones to wash it. Maybe it's a spouse or a child that ends up putting it into the washer and dryer. There you go, you've got a contamination. But if that person, he or herself, run it into the dryer, is that a solution, or it doesn't even work?
I think this is a very serious challenge that you brought up. Dr. Adiam, if you could go ahead and answer this one.
So the question is how putting clothes that you wear out and about at work, what do you do with it? Can you just put it in the dryer and then leave it there for it to get washed at a later time? Is that basically what you're asking?
Yeah, let's go with that.
Okay. So again, how long are you going to put it in the dryer? It all depends. So, ideally, like Dr. Hanna mentioned, washing it, or what you can do is having what you wear out to work, and as soon as you come home, maybe through the garage, maybe through the basement, or through, I'm not sure, but somehow having putting it in a different container, plastic or something. And you can, if you feel like washing it every day may be too much and so forth, maybe putting it aside for another day, and then you wash it at the end of the day, at the end of the week, or it's hard to say exactly if putting it in the heat, how long are you going to dry? How long are you going to put it in the heat, and so forth. So ideally, the best thing would be to see if you can, change your clothes. But again, Uber driver, you're sitting, you're not really touching. Can somebody else help me with this? If you are doing your best to use the sanitizer and wipe down your car, and so forth at the end of the day, and then change your clothes, and then use a sanitizer. Leave your clothes somewhere, your shoes as well. Really, that we are saying that to healthcare professionals who are in the midst of being exposed. Don't wear your jewelry, don't wear any, remove all those things. And before going to work, and then when you come home, change your clothes, put it in a wash bag, and then change, leave your shoes outside, maybe in the garage or something, and then come on in with slippers or new shoes and things like that. So taking all the extra precautions. It sounds like putting it in the dryer should help, but it all depends on how long are you going to dry it and so forth.
Thank you, Dr. Nadia.
And the other thing is making sure to sanitize everything else. Your phone, your badge, if you have a badge that you work with, and then if you take lunch bags, make sure that it is in a disposable bag. Things like that, that can help as well.
So I just want to add one thing. I was just looking at on the web, and so what they said is that probably what you would do for the flu virus will be the same. The flu virus gets killed about 167 degrees of Fahrenheit, heat, whether it's, I don't know how hot the dryer gets in when you dry it, but clearly the CDC recommends really, if you feel you're outside and you may be exposed, you got to wash it and then dry it is what they're saying.
Great. Thank you, Dr. Adiam and Dr. Hanna, for answering that question. We have another question that was emailed to us that I'd like to get to. In this COVID-19 lockdown, how do we best manage our relationships in such tight quarters, i.e. significant others, children? Dr. Tsegai, if you could answer this one.
Yeah, I mean, the single most important aspect in all this is communication. And if we've not thought about it, then it is time to think about it now. Because usually, especially in North America, life is tough. Both parents work usually, and they have no time to talk really a lot with their kids. You have to make the ends meet, and you have to keep up some life standard, and you have to pay mortgage, you have to support families back home, etc. So the pressure is high on us all the time. Now we are at home. Suddenly we are having a lot of time. And what do we do with this? This is new, because there are other people that have been taking care of our kids, maybe at school and elsewhere. Some may have nannies, some may have other places and opportunities. But now we're stuck at home, and it's a new, completely new experience, and we have to redefine our lifestyle. And the uncertainty that human mind cannot deal with is here. We want to rush it. We want a quick solution so that we can move on in our life. But the situation is saying no. Still it's uncertain. These expertise presentations and reviews that we've heard today has not gotten us any closer to believing this is going to be over soon. It's going to take time. So we have to adjust to the situation. And the faster we think about it and try to find ways to cope, the better it is for all of us. We are together on this, and It is really getting together and talking about how we are going to do this as a core family. The day needs to be planned, basically, because you can't live into the day without having a plan, because otherwise, every kid and everybody in the family does what they do, and instead of getting connected, you end up arguing and fighting maybe. So there has to be a way of finding rules. This is a time when house rules mean a lot more than before, because we are there, some of us in an apartment, some of us in a house. So whatever it is, we are closed in. So we need to talk. We need to talk what we want to do with the day. And I think kids have got the right, and everybody has got a right, and let's talk, and find a way of enjoying the time, reestablishing communications and ways of being together and enjoying the day. Starting, as we were saying before, with the sleep schedule. The risk that you can see is, for instance, that somebody goes to bed late at night and maybe somebody else a little earlier, and somebody wakes up earlier, and the other person feels disturbed because somebody is making noise, etc. So if we don't sort this out and have rules, then we are prone to conflict. That is very important to take care of. Sitting down together and set rules. When is going to be bedtime, and when is going to be a wake-up time, and what are we going to do after waking up, making sure that everybody takes care of their personal care and hygiene, and do as if it was a normal day. We have to normalize this, getting up and getting dressed. That's very important. And ideally having breakfast together, meals together, and plan together. Is there something that parents and kids can do together, siblings can do together? That is what would make these maybe even a memorable experience, where we can look back and say, wow, we've got used now to a real family life, and we are enjoying this, and it's just a shame that this is going to end. I think that's where we have to imagine it being possible, and this is not impossible. It takes talking and having a plan, and everybody going by the rules. And if we do that, and schedules and activities, then I think we'll be just fine. It's not impossible. And now this is a time when we have to accept and adjust. And I think we have the potential to adjust, because our brain has endless limits.
Thank you, Dr. Tsagai. We're going to go ahead and use that as our closing remarks. I want to thank everybody for all of their questions, both called in and also emailed to us. Just to recap, I think some of the key points that we take away from here today is prevention is key. Keeping hygienic, masks are necessary. We can make these on our own at home. You may not be showing symptoms. However, being asymptomatic or possibly not having been infected yet, we still need to take these precautions very seriously. Key points from Dr. Solomon regarding hope is on the horizon. Treatment is being studied. Vaccinations are being researched. Dr. Tsagai as well touched on being open to talk to each other, hear each other out, work together to build safe, healthy households as we combat this both indoors and outdoors. Reaching out to one another, finding laughter. Don't get too consumed by all the information and a lot of misinformation out there in regards to COVID-19. So I just want to hope that everybody goes forward and stays healthy, stays safe. I want to thank our outstanding panelists for their time today and answering all of these questions and giving us their expertise on this subject matter. So thank you all.